So welcome to all of you online as well. We have much more, in fact, registered participants online. They are here in the room. This is the first European forum on non-pharmacological interventions. And I'm Cécile Hériard. I represent INSERM here in Brussels. So INSERM is the French Institute for Health and Medical Research. Just very quick words so that you know where you are here, maybe, and what INSERM is. So this is a sort of French science house here in Brussels called Maison Irène and Frédéric Joliot-Curie. So this is a maison, both a house and a home. You should feel at home today, please. And it's meant to be a bridge between scientists and EU institutions. So we're doing our best to bring all the latest scientific outcomes from our communities, from our members in France, all their foresights also to the EU institutions. And as you know today, evidence-based decision-making in politics is not a given. So it's more needed than ever, even at EU level. And we also bring Europe to our scientists. So through information on the funding programs, on the regulations, and the political orientations of the Commission, etc. So we have almost 30 members. I'm just trying to, 30 members that 13 of which are permanently based, represented here in Brussels, and out of which INSERM, that I represent. And we also have 16 associated members who don't have any office here, but they benefit from our services as well. So altogether, we cover all major scientific fields that are being led in France. Now, INSERM is the only French research organization that is entirely dedicated to health biomedical research. It's quite an old organization. We are turning 60 years old this year. And we have around 300 laboratories spread all over the country, 34 clinical investigation centers. Most of them are jointly owned with university hospitals, 80% of them. So we employ 2,200 permanent researchers, but altogether in our research labs, we have almost 14,000 people working in our labs. And among them, Professor Grégory Ninot here, who has guided, coordinated all the work on non-pharmacological interventions in France since several years. Maybe just one word about money, our budget, it's important. So it's roughly 1.2 billion a year, and 60% of which comes from the government is public money, and around 40% is external resources, so contracts with the industry and so on. 1/3 of these contracts come from the EU. So the EU is definitely a major funder for us. And it's, of course, much more important than just money. So I'm very pleased to open this forum today. It's about major and urgent need, which is building a common science-based, scientifically validated framework for NPIs. It is urgently needed to have a sound, accredited, traceable framework, but it takes years to get it, and a lot of participatory research is needed, to be constructed. Why is it needed? It's needed because I think all of us, as patients, as parents, or healthcare professionals, we are still a bit lost in this world of NPIs and health today. In fact, anyone can post his or her experience on the web with, nutritive change or a nice manual therapy, a plant, whatever, that has really improved her life, her health. And anyone can say that it works, that it's fantastic, it's the remedy and so on. But this can be extremely misleading because what works for one case doesn't necessarily work for another one. And this is what we call a bit, fake med or fake health news on the web that has exploded during the COVID-19 pandemic. And so patients try by themselves, what they find, because their medical doctors sometimes don't have the sound evidence on what is really indicated, what are the counter-indications, and so on all this. So that's really the challenge. Not much in this huge spectrum of NPIs is really well assessed. It's not centrally registered, and it's not regulated at all. But there's a very good news, is that NPIs do really help, be it from prevention to treatments, from child health to end of life. It helps all along, even in utero exposure, I would say. So we will see many examples today that it works and that it starts to be centrally registered and assessed on the ground of scientific evidence. So this may be a final remark from my side to avoid any misunderstanding in the public. NPI framework, NPI registry is not meant at all in opposition against, medicines or to replace very efficient biomedical products in Europe, medical devices, surgeries, AIs, and so on. The goal is rather to complement these solutions to obtain even greater results. It's not against that at all. It's not an alternative approach. It's a targeted protocol or prevention or care that is registered and supervised by a qualified professional. So it will be useful for precision medicine and personalized disease management strategies. So this is very broad, as you can imagine. It's multidimensional, intersectoral, multidisciplinary. And this is reflected also in the spectrum of participants today because, we don't see all of those online, but the registrations range from Ottawa to Tokyo and from individual caregivers to patient associations and ministries. So it's time to kick it off.